Jim had this question. He's a 62-year-old experiencing cramping in his feet. Cramping in his feet is new. This is a new experience for him. What does that initially tell you?
It's interesting that you can actually have people that will get peripheral vascular disease complaints related to the feet. Kind of the classic description that most people describe is they walk a certain distance and they get, as we talked about earlier, an aching and burning. And the classic description is in the calves. But there are patients who will get it in the thighs, in the buttock, in the feet. And so you can actually, instead of what would be the textbook classic description, and you can see it in alternate areas. So if he's getting cramping in the feet, especially in the scenarios if it gets worse with walking, it's better if he rests it. Do they get it in the middle of the night or not? Those would be some things that he could kind of ask himself to say, okay, well, is this more likely it's a vascular disease problem? And typically if it's worse with activity, he doesn't get it as much, or it completely goes away if he takes a break. It's a consistent amount. He walks half a block and it starts, and then he has to stop and rest due to that cramping. Those would be some things that he could kind of ask himself to say, well, is this more likely a vascular problem versus
what do you treat? How do you treat then in that instance?
Well, it's interesting. Not all of the treatments are surgical. And one of the nice things is we have a number of options that are available now for patients that are non-surgical. So it's not that there aren't patients that need angioplasty and stenting and bypass, but there are some medication options, there are some other non-invasive options for peripheral vascular disease that in those patients that come in who maybe are limited with their activity, but they say, I'm not sure I want to have a procedure. I don't know that I'm ready to have a surgery or not.
Right.
The nice thing is there are some things that we can try first. And in a lot of those patients, they do better and avoid a procedure. But in the ones that don't, it still gives them something non-procedurally to try first before going on to something.
All right. We have a call from Larry now. Larry, you are live with Docs on Call. What's your question?
Yes, I've had a low blood pressure situation for about the last 3 years. At times it's been like 70 over 50. And I've been diagnosed with what they call vasovagal. And I was wondering if there's any way possible to get some kind of treatment to bring the blood pressure back up to normal.
There certainly is, but I think that first of all, it's important to figure out if your blood pressure is really low in both arms, and if there are any other associated abnormalities with that. For example, do you notice that the blood pressure is low when you're changing positions from sitting to standing? Do you have symptoms when the blood pressure is low? If the blood pressure, for example, is 70 in your left arm and 140 in the right arm, then you could be having an abnormal reading on the basis of an obstruction to the artery that supplies blood to your left arm. Blood pressure also, I think, is one of the key risk factors that one needs to manage in terms of what Scott was talking about earlier. Many of the people, probably the majority of the people that we see, don't need an intervention. They don't need an operation or a balloon angioplasty. What they need is control of their risk factors. And just to finish up with this gentleman's question, is there anything that can be done? Absolutely, there are medicines. Some of your medicines may need to be altered. You may need your heart rate raised. There may be a pill you need to take to raise your blood pressure. But first, you got to make sure that number is accurate.
All right, very good. Rick has a question for us. Rick, you are live with Docs on Call. What is that question?
Hi, doctors. I'm a 57-year-old male. I don't have any vascular problems that I know of. For the last year and a half, I've decided to take fish oil pills. And I was wondering if there was a lot of truth to the fact that taking fish oil, like say 1 pill per day, counters the cholesterol buildup in the vascular system.
All right, doctors. I'm sure you've heard a little bit about this quite a bit. What do you think?
It's interesting because a lot of the studies, when we look at this, seem to kind of flex back and forth on what's recommended. I would say the short answer is I think it would be helpful for him. It's not going to hurt anything at this point. There is some underlying genetic component to it, but if you are genetically predisposed to having high cholesterol, adding that supplement may not necessarily correct it. We haven't seen anything, and I don't know if this is partly where your question was heading also, because I'll occasionally get similar questions from patients who will say, well, will this clean my arteries out if I take this? And if I've got underlying plaque deficit. Exactly. And that's, it's a very common question. They want to know, well, will this clean everything out? And as you said, rotor-rooter it out. And we haven't really seen anything that does that. But from a preventative standpoint, I think it's a good idea. Certainly looking at your cholesterol levels, all the different cholesterol levels that you have, because certain ones, if they're high, can offset other ones being high, or from a risk factor standpoint. So certainly I think it's reasonable. Go ahead, take your fish oil. It's a good idea. But certainly I would suggest, even if you don't have any other active problems, still be a good idea, especially at 57, get those cholesterol levels checked, especially if you have a family history and see you may need something more than that.
Absolutely. Okay. We have another question from a young man named Larry. Larry, what is your question for us tonight on Docs on Call?
Good evening. My question is, I have a epithelial aneurysm behind my left knee. And I do have it ultrasounded twice a year. It's 1.2 to 1.4 centimeters. At what point do I have to be concerned about either having that bypass or stented? Supposedly it won't shrink in size.
Very good question. First of all, a 1.2 centimeter aneurysm is pretty small. The risk of these aneurysms, I think it's worth noting, is that the contents will enter the bloodstream. If you bend down, say to pick up your keys off the floor, or to get something under the bed, perhaps, if you drop it, the contents of these aneurysms then can go downstream, and it's a very devastating problem. So if there is a true aneurysm, that contains a lot of debris, we look under ultrasound to see what the contents of the aneurysm is, then we tend to treat those, I think, earlier rather than later. I think that a very good alternative treatment, rather than having a bypass to that, is to have a covered stent place. This is something that can be done as an outpatient or overnight. It has a very good track record. A lot of the side effects are minimized, and I think, at least in my practice, I'm sure Scott, feel free to comment, that the short and medium term follow-up for these is every bit as good as surgery. But once again, I think that it's important maybe not to wait until they're too terribly big to have them treated.
So it's a good thing that, well, you say a 1.2 is relatively small, that he's monitoring it, that he knows that it hasn't been shrinking, and that would be something for him to consider as far as another alternative to surgery.
One other point I'd like to make is that this is one of those circumstances where if you have one of these behind your knee, you probably should look in other locations to make sure that you don't have an aneurysm in your abdomen or in your chest or behind the other knee.
All right. Very good. Eileen has a question for us. Eileen, you're live with Docs on Call. What's your question?
Well, I'm a 74-year-old female, and I have had numbness in the bottom of my feet for the last 5 years. I don't have any pain. I don't have any trouble walking. I can walk distances. But when I mentioned it to my doctor, she just wasn't at all concerned about it. I mentioned it to her maybe a couple of years ago. And I'm wondering, should I be concerned? It doesn't seem to be getting any worse. My toes are numb also.
Do you have any history of diabetes at all?
I do not. I have been just diagnosed, though, with a kidney disorder. I've lost 50% of my kidney function, and I'm just wondering, are the two associated? My sonogram showed that my veins were fine. It looked good.
And you said you can pretty much walk as far as you want.
Oh, sure.
I would say that the numbness, not that you shouldn't be concerned about it, but I would say that more than likely the numbness is not a vascular-related problem. If you're walking as much as you want and that doesn't seem to really affect anything, it's less likely it's a vascular problem. If you've been looked at for diabetes and that's been ruled out, that would be the next scenario. Now, you can also see numbness in the feet and numbness in the extremities related to pinched nerves. So if your doctors have ruled out diabetes, Again, I think it sounds less likely it's an acute arterial kind of vascular problem. Certainly, you mentioned you've had some Dopplers or some sonograms done. Those could be done on your arteries to double check. But if your doctor can feel pulses in your feet, your arterial supply more than likely is just fine. And then I would start potentially looking at those other areas. So it doesn't sound like it's any acute emergent situation, but I would agree with you. I think it's not normal, and there are some other options there that you could look at if it's, from a concerning standpoint. Sure.
Just a couple of minutes left for Docs on Call. You can ask your questions by dialing 698-3742. Doctors, if you had one message, one point you wanted to make tonight to our viewers, what would it be?
Stop smoking. Neither one of us would have a job if people didn't smoke in this country. It's one of the single largest controllable risk factors for peripheral vascular disease and early and sudden death.
Yeah, I would agree too. Marlboro is a big funder of our kids' college accounts. But separately from that, I think we touched on this earlier. Don't assume it's just a natural progression. So if you're having a cut or sore that won't heal, or you're having problems in the feet or legs, don't assume it's just part of the aging process. It may be something else going on.
All right. Well, Jerry had this question. AAA rupture, grandmother passed away from ruptured aneurysm. Does this increase her risk?
Yes. It does.
It does.
It does.
Absolutely.
I was just saying, there is a Medicare-approved screening program now for AAA. So for those patients in your audience that are of Medicare age, there are some guidelines for it, but Medicare does approve a one-time screening for abdominal aortic aneurysms for certain patients.
That's good to know. Good to know. And this person, coronary sentinel 3 off Plavix for a year. Should he be back on it?
I think that's a decision to be made between he or him and his cardiologist, because the need for Plavix is frequently related to whether or not the stent is drug-eluting. When the drug-eluting characteristic of the stent is passed and the stent is healed in place frequently, the Plavix can be stopped. The Plavix is a good drug if people can tolerate it.
All right. Doctors, thanks very much for your time here tonight. We could continue, I think, for another half hour. Thank you to our viewers for watching and asking your questions. And remember to tune in again in a couple of weeks for Docs on Call. I'm Gina Morse. Good night.